In this lecture, we will discuss the mandible left posterior view. This is the posterior view of the mandibular bone. First, we will discuss the labels. There are 7 labels. Then we discuss the clinical point of view. First, the label 1, you can see it's the condylar process. In the previous lectures, we will discuss this. This is the condylar process. The second label, you can see this is the lingula. Third label is the mandibular foramen. This is the opening. Third is the mandibular foramen. Fourth one is the malleohyoid groove. This is the groove or depression. Fifth label is the submandibular fossa. This is the submandibular fossa on the posterior side. Sixth is the sublingual fossa. This is the sublingual fossa. And the seventh last one is the mental spines. These are the mental spines. In this lecture, there are foramens and the grooves and the fossas we will discuss. First is the condylar process, second is the lingula, third is the mandibular foramen, fourth one is the malleohyoid groove, this is the submandibular groove, sixth one is the submandibular fossa, this is the sublingual fossa, and the seventh is the mental spines. Now we will discuss the description of it. The inferior alveolar neurovascular bundles enters the mandibular foramen. I told you from the foramen neurovascular bundles pass and supply the structures and course through the bony mandible to supply the mandibular teeth. Mandibular teeth are lower jaw teeth and gums. Depression or fossa on the medial side of the mandible mark the location of the submandibular and sublingual salivary glands. These are the salivary glands, and from the fossa, neurovascular bundles enter the bone and supply the structures. And now we have clinical. Mandible is the strongest and largest of the facial bone. It asks in the MCQs. Note it. It is the strongest and the largest of the facial bone, and its landmarks are used for dental anesthesia via intraoral injections. The injection in the mouth properly performed, the infiltrating anesthetize the inferior alveolar nerve and the lingual nerve ipsilaterally. Ipsilaterally means same side as the injection, where they lie in the pterygomandibular space proximal to the mandibular foramen. This will anesthetize the mandibular teeth, the lower jaw, the epithelium of the anterior two-thirds of the tongue, all the lingual mucosa and gingiva, and the buccal mucosa and the gingiva of the buccal mucosa from the premolar to the midline. Mental nerve is the terminal branch of the inferior alveolar nerve, and the skin of the lower lip ipsilaterally means on the same side. This is the clinical overview of the mandibular bone. It is the largest and the strongest bone, and its landmarks are used for the intraoral injections. Okay, and we will discuss the nerves and the mucosa, lingual and the buccal mucosa, and all the sensations that provided by this nerve. In this lecture, we will discuss the mandibular left posterior view, its landmarks. There are 7 landmarks, and its importance and the clinical. I definitely sure that you like this video. Thank you.